Good evening, everyone. We are here with yet another session. Today, we are here with Dr. Pradeep, sir. He is professor and headed research at Sant Hiradaram Medical College of Naturopathy and Yogic Sciences for Women in Bhopal. He is the director of Indian Academy for Scientific Writing and Research, which is situated in Pune. He was the first head of the research and development in National Institute of Naturopathy, Pune, with this 50 research papers under his names with 38 chapters in different textbooks, national and international textbooks. He is associated with the Ministry of AYUSH, CCRYM, and many other things are associated with him. His research area of interest include epistemology in naturopathy, fasting, biorhythms, gut flora, medical ozone therapy, and public health. He works as a research consultant for various organizations of repute. So with this small introduction, without taking much time, I would like to welcome you on our platform. Thank you so much, sir, for your time.
Thank you, Dr. Bhavit, for having me here. It's a long pending one, like we have been discussing for so long about this session. Yeah, and it's very heartening to see this own year growth. Is definitely a need of the hour for our fellow BNYS participants, and which caters a lot of recipes on how to take your naturopathy and yoga career ahead. So, and I have seen many videos about OYG's videos also, like it is everyone is unique in its own way, and the kind of knowledge you are disseminating is really great to see, and I hope it will be benefiting a lot of participants. Yeah, so coming to today's topic, research career in yoga and naturopathy. So it's one of the least opted field, because if you see in a BNYS college, there are 100 students. Out of that, we will get 4 or 5 researchers, and remaining 95 will either become clinicians or acupuncturists and different other clinical roles or academic roles what they're taking. So unfortunately, if you see the amount of physician scientists we call us, like either we are either a physician or an academician, or we are a hardcore researcher. So we were never meeting with each other. Researcher will do his own research. Physician doesn't bother about what researcher is producing as evidence, because he has its own ideas and clinical sets of knowledge what he's doing. And in college, what we teach is having no link with what we do in clinic or what a researcher is bringing in. So the need of the hour, because now we are not a nurturing system anymore. When we were studying in BNYS, we will say we are still a baby, and we are still growing, but we have grown enough, and now we have close to 7,500 plus graduates spread across the country and the world, and doing their own bit about what they can do to develop the system. So now the need of the hour is to integrate the research, the clinical activities like a physicianship and the academicianship. We need to merge together so that the future doctors, now whenever we teach in our college, we feel that at initial days people feel that why we have chosen BNYS, but after 13 years I can vouch for it, like BNYS is the best decision which I have taken in my life, because no other system of medicine can cater to a condition holistically, and we are as evidence based as any other systems in the world. But problem is, like, most of us, we do not know where to look for evidence. Like, start with our philosophies or start with our clinical approach, and we are still confused with using a temperature, whether it is a hot or a cold in a particular condition, or in a swelling, which kind of treatment should be used, and in a non-swelling pain, what kind of treatment should be used. So this kind of evidence we do not know where to look for. And unfortunately, from beginning of our school career, we still study for an alphabet A, it stands for apple. We will never thinking about A for aeroplane or A for abacus. We never think, and still my daughter, she is also A for apple. So by a way, our educational system is meant in a way that we memorize things, we don't think critically, and we don't look why a particular magnet should be put in a North Pole, why it should not be in a South Pole. And whatever we do understand, we say it is a pseudoscience. Like be it the iridology, be it the chromotherapy, and we are very fascinated about nutrition, fascinated about yoga, fascinated about acupuncture, because the modern medicine persons has experienced and established the clinical aspect of that. But we do not see the same kind of fascination for our other treatment steps, because either we are not ready to explore what is happening over there, or we are not kind of trained in a way that we should be using a skill of research, because research is an everyday tool which is needed for everyone, starting from the first year. When you see about, like we all study in our PNC, that inflammation diagram, where there is and it will be ending with a regeneration or destruction. But how to put that inflammation diagram scientifically, how to present that scientifically. Like whenever you want to present your theory of vitality, toxemia theory, and accumulation of morbid matter, we are not left with answer. And still in academics, after 70, 75 years of academics, we are still don't have an answer how to define vitality. Or and if we ask someone, they'll say it is like immunity. They'll be saying it is a kind of a force within us. But what is that? We are not able to establish that. So at this point of time, if at all we want to take naturopathy and yoga to next level, and we are the only yoga and naturopathy doctors available in the country, and the unique curriculum where we have inpatient hospitals, only other than Germany, only we have the inpatient hospitals where we cater naturopathy and yoga as a proper medical care setting. Right now, it is a need of the hour. Every one of us should be taking up research as a career. And most of the time, what we feel that as a researcher, we don't able to make much money. Like as if you're a clinician, you put acupuncture, you may be getting 1,000 rupees per sitting. Same applies to yoga, or you can work in an online platform if you are good in nutrition. So there are a lot of things where you can, when you look for the financial aspect of it. So you always think that, okay, research is something where it's very difficult to do, because always when we speak about research, we speak in such a way that it looks complicated, so nobody will dare to touch it, so that we will be the prime researcher forever. So we need to democratize research. We need to make research everyone's cup of tea, and nobody should be scared of taking research. For that, what we need to do, we need to develop that kind of instinct in every person. And from the financial point of view, I was telling that research is not a place where you won't get money. Research is a place where we get a lot of money, because as I told, the number of proportion, only 4 people out of 100 will come to research. So the need of people now, the kind of consultant opportunities I get within naturopathy and outside naturopathy. There is so many people wanting to write paper, but they do not know how to write a paper. Like people, we have brilliant physicians in our field. They recently I got from one of my colleague, uterine ovarian torsion was treated by acupuncture alone. It is very fascinating. And during my clinicianship, I have seen we have rushed the patient to a hospital, and it was an emergency supposedly. And these people and these kind of physicians are available among us. But problem is like we are not able to publish these things, and so we are not able to teach that in our college that yes, this happened in a place. Then this is a kind of treatment approaches what has been done. So training in research. So even like Dr. Naveen KV, our president of Enigma, calls me as the knowledge entrepreneur. So I kind of commercialized research, and I made cater to whoever wants to take up research as a career. If you're really interested, you can come up and take up that particular thing. And what are the kind of avenues we have as a researcher? So when you are going for a job interview, for example, if you are just a BNYS with an MD, or you are a MD, you are a BNYS with 10 publications, definitely the employer will look for the 10 publication, because naturopathy is no more just naturopathy. It's an integrative medicine. We have multiple doctors, multiple streams of physicians working in a particular setting. We have multi-specialty hospitals where naturopathy is being taken, and even kind of the research yoga research being funded across the world. There are need of a lot of senior research fellows. And when one of my colleague, Dr. Chandrasekhar, who is into clinical trials, when we look for people who can be placed in premium medical colleges, we do not have people actually. Like we have only BNYS, but they do not have a research orientation or experience. So a lot of avenues are senior research fellows, junior research fellows, which will be paying you handsome money. And along with that, when you have the research aptitude, the employability of you will be increasing. And right from your studentship, like I'll give one example from SVSI University alone, and we all are very proud of him, where Dr. Sriloy, okay, I met him when he was an intern under me in NIN. So when he reached NIN, he already had 4 publications during his BNYS studentship itself. So he came to NIN and he was behind all of us, sir, let us do something, sir, let us do something. 3 months he was doing internship. By the end of internship, I have increased my paper to 15 and his count went to 10. And now, for the first time in the history of India, a senior medical officer post in AIMS has been cracked by a BNYS person, and he's sitting as a senior medical officer, wherein all other AIMS, it is reserved for an Ayurveda doctor. So and he is having 37 publications to date as a researcher. And I just want to quote my salary or what I earn per month, like just to motivate everyone. So I roughly make around 1.6 lakhs per month, just being a researcher. where I write for people, I take my classes, I work full time. My seniors getting less salary, I'll be paid more salary because I have research aptitude, I have published literature in the field. So you will be preferred more among the others because we do not have many amount of people around us. Like even in previous times, we do not know where we publish. Like there are a lot of predatory journals, like you give 2,000 rupees, they'll publish your paper. And after that, the paper is no more used in here because it is not in an index journal. But right now, the knowledge about publication, and even if you see the recent notification of National Institute of Naturopathy, if you want to become an associate professor or a professor, there is a minimum requirement of number of papers for you. So for a career in future, this is going to be very mandatory. Like previously, if I ask my students, how many of you are interested in research, half of the class will not raise their hand. Now it is not about the interest, it is the need of the hour. If you want to speak about something to someone, you would be requiring research backup. Like just to give an example, like as a naturopath, if you take a topic of vaccination, you can be pro-vaccinated or you can be against vaccination. But for speaking on either side, you would be requiring backup of evidence where, and you should know from where we should be picking up that evidence. You cannot just read WhatsApp forwards and tell that this is right, this is wrong. You should be knowing that how you can speak about a particular thing, how you can advise a particular thing. So that will be more important. And clinical practice guidelines cannot be formed just individually. 7,500 people spread out in different cities and villages in India. You do your own things and you don't publish, you don't even tell to your colleagues that this is what I'm doing. And until and unless we publish something. Now, if you ask what is the standard interventions we give for diabetes, we do not have a common answer. What is how you manage psoriasis? We do not have a common answer. And what special treatments people might be doing also, we don't pull in a particular place. Very simple like that. What is the best time to do sun exposure? We have time from people say 7 to 10, people say 10 to 3, or somebody will be saying 1 o'clock, somebody will be saying no sun exposure at all. This kind of confusion comes because we are not pulling in the data, we are not seeing the things together, and so we are not able to connect the dots. So even during all my sessions, I reiterate and integrate. Like if you just take, we always say that whenever a disease is coming, we say that a disease is because of impairment of 4 major eliminative channels. How we are going to scientifically explain this? We are not in a position to explain it at this point of time. Because we have to see the gut separately, we have to see the lungs, how it works in a particular condition. If you take a cardiovascular disease, how lungs are involved in cardiovascular disease, how your kidney is involved in cardiovascular disease, how your gut and intestines are involved in cardiovascular disease, what is the role of skin in cardiovascular disease. You have enough evidence available. And if you know how to search for this, first of all, you will get convinced that yes, naturopathy works. Most of the people does not believe or does not stick to naturopathy for a longer period of time, and most of us use antibiotics and other things because we don't believe in this particular thing. Because the other side, modern medicine is why modern medicine is so appealing for us, because it is highly evidence-based. If they say one penicillin in this dose, this will happen, it will happen. And why we are not very fascinated about this? Because we have never attempted to pull in evidence. We have never attempted to, because it is very complex. It is not easy like that. You just SARS-CoV virus is the reason for COVID-19. But for a naturopath, it is not just SARS-CoV virus. It is how you eat, how you sleep, and how you interact with people. It is about all the planes of health together. So looking into all these planes together, it is very, very complex. Whereas in a reductionist approach, it is very easy. We can just say, okay, SARS-CoV, attack it with different antiviral agents or antibiotics, you are having the answer. So to make naturopathy more fascinating, to make yourself more viable as a physician, if you want to have lucrative jobs in your future, it is very mandatory that you are going to take up research as one of the career option, where it will be going to be a very beneficial option for you all to make your career as a better thing. So I think that is well enough for opening thing.
So thank you so much, sir, for these many what we say outlines we can see on this points what you have said, that these are the outlines which a student should explore. So now first question I would like to ask you, sir, that there are few students whose mindsets are not driven towards research, and they are like, if I'm interested in clinical, I should be doing clinical approach. If I'm in academics, as you said, the trilateral approach we a student has. But how to develop that approach of integration of three things, because without integration of any of these three, you cannot work as a researcher also, cannot work as a clinician, or you cannot work as a academician. So how do you think we can make a bridge by doing such kind of things in the BNYS, not after that? Start from the first year, so you develop that interest and reach up to the final year, and you would have an idea what is research, how to, because we do have a subject called research methodology, but at the end of fourth year also we are at the same stage. So how do you see and how do you think that these things can?
Yeah, so it's a very good question. So actually what happens is like we are a very small community, like, and we have alumni. Like if you take the example of your college, you have very good alumni and you are one of the example of the prime alumni of your college. So you are into different field. Like for example, and the academician should not just think about, okay, I need to finish my syllabus and I'll just get out of this so that they'll write and they'll get the marks. That is not the just job of them. And academicians, most of us, you don't go to the clinic and you don't explore much with the clinic in many of the colleges. You just teach and you don't have any patient interaction. Whereas the persons who are into clinic, they don't come much to teach in the college. They are with their patients. So there should be a kind of a knowledge transfer between both of the places. Like from clinics, the cases should come. So like how I do in our college is like whenever if I am taking, for example, cardiovascular disease, if that is what is taught in the final year, holistic medicine. What I'll do, I'll initially present what is the scientific basis of, from the philosophical aspect, what cardiovascular disease is, how it is being, incidence is happening, and what are the kind of different contribution of different systems, like say GIT or your skin or your lungs and kidney, how impairment or compromise of this function is contributing this first thing. I'll be explaining, and I'll be giving a holistic causation for a particular thing. Then what I'll do, I'll ask them to go to the clinic, pick up the case reports of similar cases and bring and present and see how much the theoretical knowledge, what you have learned over here, is there in the clinic, where you are able to see that. So if I say that for every disease, there is an individual cause, that is a unity of disease. So a person has a story to tell, and during your case report taking, you will be finding that particular story. So that is what I tell in my classroom. So you go and interact with your patient, other than what you're seeing like inflammatory marker rise or a blood sugar rise, whether the person has a personal psychological story to tell to you that is triggering the inflammation, the flight or fight mechanism, which we learned in the physiology on the first year. We forget that and we are so much into pathology after that in our life. So when they go and interact with the patient and when they churn very much, there may be a domestic violence or not liking the job or a sexual abuse, different kind of things will be there where the patient is not able to share because nobody asked them. Because diabetes, okay, blood sugar. You don't think beyond blood sugar for diabetes. So the students will bring that and that will be coming in. And the third part is like, we share our own papers and publications within that particular domain inside the classroom and see that if I am doing this, how this is going to be helpful for a person outside. Like recently, we have done a vitamin D supplementation for psoriasis and we have published it. And somebody from US took that paper and she was a psoriatic patient for 21 years. Nothing worked for her. She started high dose of vitamin D. The psoriasis completely cleared off and she wrote an email to me. And I showed to my participants that this is how it works when you publish something, how it can change the domain. So how to solve this problem? The successful clinicians should send their cases to the colleges, to the respective departments, because, as a student, you may feel that this could have been better. And when you come out, who will be making that feel better? We have to do that. So we need to return back that particular thing to our mother institutes and the college for the benefit of our juniors, where we'll be sending those cases over there, and academicians should discuss that in the classroom, and this is how the approaches should be. And writing the papers from the beginning, you need to train. It is not like that everyone will start writing from the first day onwards. And you are a first year, you don't be a part of that. All the journal clubs, whatever you conduct in your college, and right from the first year, the kind of clinical briefing which has been given. And almost every college has at least one researcher available in a college where he can take the initiative of those kind of integration between clinics and academics, and how can they present a particular thing in a classroom. And this will, on a longer term, I feel, definitely bridge the gap.
So these are the points which we know that. So my next question would be from this, that how do you think reading the books, reading the journals is very much important, and how do we read it? Because we are not trained to read the books. We are trained to read the notes most of the students will talk about that I have got the notes, I have read from the notes, and I have passed my exams. But that should not be the clarity. If you go through the whole book, there are so many concepts which exam might not cover, but your life should require to treat in clinical basis. So how do you see that reading the books and then the journals? Because every book, the first year is correlated with till the final year. So that leaving the first year and reading final year would not help anyone. So how do you suggest your students or those who are going to see this that this reading the books and journals are very much important in our life?
Yeah, so like the mentorship which we provide to a student is very, very important in shaping their career. Like, students will do only when they want to do this if their teachers become strict. Like if I give a notes, if I just present something from a PowerPoint, I take a class and I go, student will be expecting something from that PowerPoint to come for the exam. So we should break that ice first. It should not be from the PowerPoint. So what I do, I give a PowerPoint and I will be giving the reference of that journal from where I have taken that notes down. And all my students are supposed to read that particular paper for that particular slide because my questions will be from the paper. So because we all are kind of inclined towards mark, because in the Macaulay's education system, the grading is more important than what if your handwriting is good, you get 100 marks. If your handwriting is not good, even if you are a good student, you may not score 100 marks. So that is what, unfortunately, our education system. So this can be changed only when we make education a participatory program. As of now, no, you should not be scared to ask a question to your teacher. Like, why cold? Why not hot? Why neutral? We have never asked this question. So we need to make it more. And we as teachers, we should not be ashamed of like, okay, I don't know this. It's okay to do not know things in front of your own students. And you can refer that because you have a better knowledge and better equipped stuff. Like you can go and refer and come back and say that. So from a textbook, what you get is like a textbook published in 2007 will be having the limited knowledge about with till 2007. When the book come to the market, it might have been 2014 or 15 now. 8 years of accumulated knowledge will be there. Like sun exposure, what I learned in my college was 7 to 10 a.m. But when I reached, now I'm a professor, when I read my papers, it is not 7 to 10 a.m. does not have any impact. It is actually the afternoon sun we need to have for Indian skin type, which is more precise. And there are much more things to do with that part. So this kind of knowledge only will be coming when you read the papers. So the books are your basics, but the papers are practical applications of how to do things, what to monitor. So when I just told about vitamin D supplementation, okay, high dose vitamin D supplementation for psoriasis. If you just read a book, you will say, okay, high dose vitamin D need to be given. But when you read a paper, when you are supplementing a patient with high dose vitamin D, you need to concentrate on the parathyroid hormone levels. It should not go beyond the normal levels, and your ionic calcium should not raise above 1. So this knowledge you won't be getting from your textbook. This will be only be provided from a clinician who have used this in his place and understood that this is a trick to manage certain things. So that is why reading a paper means you need to train the students that whenever the seminar is being happen. So I question my student, like whenever they come and put a slide, I tell from where this information is from. I want to know, because I won't allow any slides without any references over there. Without references, if you are playing something, you are actually not giving the credit to the original person who thought about that, and you are placing that as your own content. And secondly, I'm not very confident that you have read something. It can be from Wikipedia also, which is not a medical place where scripture we should be taking on. So we need to be more stricter. For that, we need to be reading things. It is not like that. Okay, I'm a hydrotherapy teacher. 10 year onwards, my this notes is working. So I don't have to prepare because I have prepared in the first year, but in the 10th year, I'm very much experienced. And I know how to fool the students and just get out of this classroom for 1 hour. So that attitude should change because we are contributing something, and our responsibility as a teacher as well as a student, like until and unless the students are asking questions, students are making it difficult for the teachers. This is not going to be changed. You will be same old and you will be speaking the same thing. And if you see the high cholesterol, whenever a patient is coming with hypercholesterolemia, we will say no oil. But the oil from food, the cholesterol from food is not at all contributing to coronary artery disease. This is what is the update after 2012. But we all are reading still the old things, And still we are prescribing in our clinics, okay, don't take oily food. But oily food is not the culprit for a coronary artery disease. This will not be coming just with the textbook knowledge. You need to be up to date about what is happening around you. Yeah.
So if you have written many books, so for the students, there are books which is written in naturopathy. So if I quote the book of Clinical Naturopathy, so if you see that book, whenever it got published, 14 or 15, the 50 or 60 chapters have the reference for each line. So if we go through all the papers, like we do not, like it's kind of a meta-analysis for a student to go through and read the papers. But we are not told to read the papers from where they are quoted the lines, but we have told to read just only the paragraphs which is given in the book. That might be the reference to complete a chapter, but not complete the knowledge, because you have to go through all the things and then only ideas will come. So if a student is having idea, there are so many ideas which comes when we read naturopathy subjects, but we do not know how to collaborate with the research. So there is a so how to deal if your college is missing with that kind of a criteria, then there is any chance for a student to look out something else from outside also.
Yeah, very again a very brilliant question. Our knowledge is not complete in any way. Like, let us say, if I say gut flora, okay, so we all know gut flora we impact gut flora with our treatments. But how much knowledge we have about gut flora, how to look into gut flora, we do not have. And do you have the laboratory? You do not have. So that is not the end of the story. Research is fortunately a field. Everyone look for a collaboration, because if Bhavit and me, both of us collaborating and publishing something, we both are growing. You are also an author and investigator of a particular thing where you are an expert. Now you have done your master's in yoga and neuroscience, where it's a new domain for me. So if I want to collaborate somewhere on neuroscience and yoga, I can definitely reach out to you and ask, like, yes, Dr. Bhavit, what is this? How can we explore this? So you will have a better idea. And when you join together, there are two researchers joining, and there are two institutes joining together, the picture is getting bigger, right? So anybody can reach out to anyone. Like the gut flora example which I was taking is like, initially we were inclined very much about, okay, what can influence gut flora other than probiotics? What can be done for gut flora? So, and when we were looking, we were having nothing. So then what we have done, we have just referred who does, when I was in Pune, this was. So who does gut flora research around Pune? So we found a guy who's a scientist from ICMR, who is a molecular biologist. He has a laboratory and he is interested in naturopathy as well. So we found him and we contacted him. We just sent an email. Like, you don't have to even have a kind of a prior knowledge about that person. So you can just send an email and say that, sir, I have this idea and I have found that you are also working in the similar lines. So how about starting a project together? That will start the initiation. For anything and everything. It is not only in India, everywhere, anywhere in the world, people are open for research, because everybody is hungry for knowledge. Everybody is hungry for expanding the knowledge spectrum. So collaboration is the best thing going forward, because you don't have the equipments in your place. Now, as a researcher, I don't get many calls from many students other than my fellowship students and those whom I taught. People can reach out to me, or there are good amount of researchers in different parts of the country. You can reach out to them. They can at least guide them to somebody like who you have trained, because we don't know many people. Like, unfortunately, we don't have inter-college culturals and things like that. We don't know many people. So people can direct you to someone. Okay, you meet this person, that person will be helping. That is how your research hungry, the hunger for research. And if you want to prove something, don't just get demotivated. Okay, I have this idea, but I don't have that enough expertise. Nobody's there to guide. There is nothing like that. You can reach out to anyone and you can publish things.
My next question would be contradictory to this, because few students to whom I know, they say their ideas has been taken by some other person.
Yeah.
So that's a kind of a scariness, like they get developed to scared to share their ideas to the collaborator, to someone, because they have faced some issues within the community where they have presented their idea that somebody has taken and not given the rights, copyrights to that person. Yeah. And second thing, how to prevent ourselves from the plagiarism, because most of the students take the references from the papers, but they are not aware of the concepts of plagiarism. And most of the institutes, being in the enhanced, they are very particular of plagiarism. So how we should think about these processes?
Yeah. So first, to answer your first question, So whenever we start sharing an idea, okay, sharing an idea has multiple way of doing it. First thing is like when you have an idea, you need to register it as your idea. How you can register that? You, if at all you are collaborating with someone, and he will not just collaborate with you just because he want to help you, because he is having also his own interest in spending time for your idea. So the communication should be through emails. Okay, first thing. First, you need to learn. We are very poor in email communication. Start responding to emails. Make sure that all the official communications you're doing through emails, not WhatsApp. First thing. Second thing, after registering your idea or interacting with an idea, even if the person has taken your idea, ignored you, published that paper, or has published a book, write to the editor that these are the evidence for this idea is mine and we have been interacting and this person has taken it away from me. You should not be hesitating in doing that. And the third thing, the stealing of the idea, again, this comes from a different school of thought. You know, like when you are a student for the first place, and you are, let us say I am a PhD student. So even though how bigger I am in my field, when I become a PhD student, I'll share my idea with my guide. You know, the idea and my idea is being shaped by that particular guide with her experience and expertise. So it is okay for the first few years to play low, but make sure that you are in a part of every project that is being taking place. So whenever it is like if you see the trend in our college, whatever the MD projects or any ideas, if the person is working from the beginning and to the end, they'll be the principal author in that. If you can see the kind of publications coming from our college, it is not that everywhere I am the first author. There are multiple people coming into multiple places. So initially you need to gain the knowledge. Like when you have got a evidence, so I have treated this patient, this is what results I have got, but you do not know how to publish it. At that point of time, to gain that knowledge, you have to definitely get under someone, train under someone. And if you just see the, okay, these are the data, please publish it. They'll definitely put their name in the first and put your name in the second and publish. Then you will go and say that, okay, this person has taken my idea and it is my paper. It is not. You need to get involved. As a paper, when we are submitting somewhere, both the authors or how many are authors in that particular paper should see the final draft, approve the final draft, the order of the research, authors need to be approved by every authors. That is very mandatory. So we need to get into the publication ethics of that. And we ourselves conduct a lot of publication ethics workshops for free. And if you are watching this video, you can request us to conduct one more publication ethics workshop. We can conduct it for free for naturopathy community. And you can join and know how your ideas should not be stolen from people. And you have to register it through emails so that you have communications. It can be withdrawn if you are sending proper evidence for that. The second about plagiarism. What is that? So plagiarism, like now you are into demands, you know that how cruel and rude are plagiarism softwares. So when you submit to a paper to a journal, the journals allow only 8 to 20% of plagiarist content. Plagiarist content is not like that you are copying and pasting. It is like the journals will ignore 20% because plagiarism software will catch everything as a plagiarism. If you copied something, for example, if you copied a definition, that's a plagiarist content. So that journal will ignore 10 to 20% different journals, but 80% of whatever you write should be original. It should be from your own thought process and what you're writing. So from initial time onwards, like make sure that if you want to prepare a presentation, don't pick up and paste over here. How to develop as an author, how you want to think by yourself when you want to write something. You have to process that information. Okay, I have read that, okay, diabetes, yoga and naturopathy is good for diabetes. That is what I have read. That information, how to present in my words, that is the challenge. So you should read that, okay, and you say that diabetes can be very well managed by yoga and naturopathy. The same sentence, you converted it into your own version, but still it is his sentence. So wherever you are taking the information, diabetes is good, you will give the reference to that particular person. It is very much needed that we are referring to every person. And it is a good practice that you are referring to the source of information because it gives authenticity. I have told before also, whenever my student present, I will not approve until and unless there is a reference to that. Initially, I will just allow them to copy paste in slides, but not in what they write. But for the slides also, there should be a reference. And this should be a habit by default because we need to give credit to people. DNA structure, we need to give the credit to that person. In 1956 in Nature, he published Watson and Crick, the structure of DNA. Wherever we use DNA structure, the credit should goes to them. And that is what, as a researcher, you will also enjoy. Even after you die, your name will be there, because we do not know clinicians, we do not know academicians. We may know some academicians, but researchers will be there forever. Who knows? Do we know Chaurasya? Do we know Sambulingam? Why we are telling them just like our cousins? Because they have contributed academically by writing something.
So these are the discussions which we go through every day when we are in the community. So not dragging to the core of this session, but the last two questions I would like to ask you, sir. So my second last question would be that how do you think that generating the skills, it's not a one-day process. It's a lifelong process. Even you are learning today also, and we are learning as a student today also. So a student might think that I can do that, but when they go for presentations, when they go for their learnings, there is kind of motivations. So what I have felt that the few students would say that when we are presenting, they have not appreciated our work, whatever the efforts they have put. Sometimes the efforts are not good, but sometimes efforts are good. So how do they understand that how much time or how much preparation they need for a small presentation in the classroom also? Not about a oral or post present, that is a very next step. But in the classroom also, there is a process to present a small seminar or journal club. So how do you think about that?
So, like our confidence will be about, like we say, we put our heart in the sleeves. That means you are into that particular topic. If you are very much into that particular topic, you don't have to look back, because that will come just like that, And why we are scared at some point of time, we think that the audience are better than us. Like they know much more things than. But if you have a process, like somebody is asking you to explain sodium potassium pump, if you know the right from the Sambulingam to your Gaitanan hall, you will not be defeated, because there is no other thing which we need to say about sodium potassium pump or anything over there in physiology. You need to just know everything over that, so that any point of time, any questions are coming, you can easily tackle. And second thing, whenever you are doing a presentation, it is completely okay to not know certain things. At that point of time, you should not be scared. You should say very much openly, sorry, I do not know this at this point of time. I'll get back to you after referring to it. This approach you should start. And education is a place where you should not be scared at all. You don't have, why we are learning? To fail and learn. It's a trial and error method. It's not like if you're perfect, you won't be coming to college. You will be directly getting into practice. Education is a place where you fail every time, so that the next time you don't make the same mistake. So the best way to make a small presentation, even in your classroom, is like how better you can make it. Like not do that just for the sake that teacher asked to do, or I had to do this as because we are enrolled into this particular program. Don't do like that. So when you are given a particular information, we have seen many students doing that. You give a topic, they teach whatever is there in the textbook. They go and do additional references from different research journals with whatever capacity they have. They bring and present those things. So their appreciation over there is not about not presenting it in the right way, which we should be expecting. What happens over a period of time, as we teachers, we look for our 13, 15 years perfection in a first-year-old student, which is not going to come. And that is why they are there for. They will be reaching the same excellence and perfection when they reach 13 years. The first year, they are there to learn that particular thing. And maybe what experience you got, you will be sharing with them. And so they will be getting better by year and year. So prepare well, not just from the textbook, from every possible where you can collect information about a topic is the best way to prepare inside your classroom. And that is an important method to develop literature searching skill, because textbook knowledge is very limited. So you need to look into multiple sources. Yeah.
And the last question would be from this, whether we have to pursue PhD to become a researcher, or is there any importance related to PhD when we look ourselves as a naturopathy?
Yeah. So, like we have two types of degree. One is MD, another one is PhD. Okay. Some people are MD and PhD. So MD is the highest clinical, clinical degree, whereas PhD is the highest research degree. In both way, if you look, an MD and a PhD is almost equivalent to their own domains. But for doing researcher or becoming a researcher, you don't have to have these degrees in first place. Okay. But how the world functions, like you have 100 papers, but you do not have PhD. So you cannot become an editor to a journal, because they look for, okay, you need to have a PhD for becoming an editor to a journal. So this is like BNYS, no? There are traditional naturopaths, there are BNYS physicians. If you want to prescribe something, the same water therapy, they may also know, but they are not having the license to prescribe because they have not got a formal education. Here, in PhD is something where you are having the highest degree in terms of research, where you are becoming a doctorate in philosophy in that particular research domain, whatever you are doing. PhD in yoga, PhD in health science, whatever you do. So from a career perspective, if you're seeing, definitely I'll recommend you should pursue your PhD and complete it, because some or the other day it will come in handy. Because, you know, I have seen a lot of very good people, since they do not have the required degree, they were not getting certain things what they are deemed or due to get for. So whatever is the requirement officially required for a particular board, tomorrow you want to become a director of NIN, that point of time they may ask for a PhD. You might be a very big scientist in the field of naturopathy, but you do not have the degree, you're not qualified. So have that in the go. But that is just to make sure that others are satisfied. But to become a researcher, you can just pursue it with the same bachelor's degree or without a degree also. Even in my fellowship, I have 12 standard students also, just with a research interest. And they do not know anything about medical science, but they come because the research is a technique where you just learn and knowledge and execute it. Yeah. So PhD degree is not mandatory per se for research, but for official purpose, it may require.
We have come to the end for this session, but there are so many questions we can always go throughout the day. There are so many things to discuss with you. So my first experience with you was the first online session in 2020 when you started the course. It's first course for 3 days. Very first course, first batch. So I was interacted with you at that time. So we have heard that NI1, NIN, they have 2-3 researchers who used to publish papers. Then we met with you, and there was a journey for us to understand that how you develop yourself as a researcher. It's not about the person that you should have a degree, because how we see you, you are training students in multiple formats, like in academics, through the online channels, through giving lectures and all. So this is how we students finally found a pathway to complete a bridge from the just a student to become a researcher with the clinical expertise. So with this, I would like to thank you, sir, to come and share all your insights with all of us. And it took long time, but it is worth it today, because whatever the time comes, maybe the discussion became more better, to the point, to the core. So everyone can learn from this today's session and many more things to come in future.
And thank you, Dr. Bhavit, and you're doing a wonderful job, and keep doing this. And I look forward to more publications from you as well.
Sure, sure. Thank you so much, sir, for motivating today also and always doing this. Thank you so much.